much more, or look that much different from the ordinary cells. And then, when you come to malignant, or the cancer, what you notice is that the cells have invaded below that basement membrane. So when you hear someone say that they have cancer, it means that the cells, those abnormal cells, have invaded below the basement membrane. If you have a fibroadenoma in the breast, or some women have fibroids, some people may have moles on their skin, some have lipomas, those are benign tumors. They do not invade. But the malignant ones are going to invade body tissue. What is breast cancer? Here you have a person about to have a biopsy done. And as you can see, there's a lump sticking up right in the breast. That's a lump. So I have a lump in my breast. What is breast cancer again? Again, if you look at that picture, what you're looking at, a woman who has totally asymmetric breasts. That right breast is normal. That left breast is completely abnormal. And I think for the next couple of pictures, I hope everyone has had this up quite a while ago. Because these are going to be quite expressive. What is breast cancer? That is a mammogram. What you're looking at is opacification in the mammogram. Sometimes, depending on how detailed it is, you see what we call hypocalcification. But there is opacification in the breast, a density, irregular mass. That will make you think of breast cancer. That is breast cancer. And even worse than that, that is breast cancer. May I ask a question? What is my chance of getting breast cancer? Well, in the world today, the risk of a woman developing breast cancer is 1 in 8. And just to play devil's advocate, 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. That's really what it is in terms of the incidence of breast cancer. 1 in 8 women is going to develop breast cancer. From my practice, generally speaking, by the time I've seen you, spoken to you, examined you, if I were to do 5 biopsies, 2 of them are going to be malignant. So in other words, about 40% of the biopsies that I do are malignant. What that means, if you've gone through a screening process, and because you've gone through that screening process, then you have once that biopsy is done, 40% of the time, that's going to come back as a malignancy. So why is it that I'm going to die from breast cancer? People always want to know why you're dying from cancer. There are many different reasons why people die from cancer. Some people bleed to death. That tumor will erode into a large blood vessel and cause it to open up, and you would bleed to death. As you saw with that last picture I showed you, the body is totally exposed. It's almost as if that breast exploded. That opens you up to infection. So you will die because of infection. Then breast cancer can metastasize. It spreads. We call them metastases, but they spread. They can spread to the brain, they can spread to the bones, to the lungs, to the liver, to the ovary, to any organ in the body, it can spread. And once it spreads to that organ, it takes over the function. Some organs are essential for life, some are not. Your liver is essential. If a tumor takes over the liver, eventually you're going to die because that tumor has taken over the liver. Similarly with the lung, you cannot live without oxygen and getting rid of carbon dioxide. So if a tumor takes over your lung, you're going to die. You don't die immediately, but as that thing grows and grows and grows, it is going to gradually suppress the normal function and cause your life to end. This is just a diagram to show you where, in particular, breast cancer is spread to the brain, it's spread to the brain, to the lung, to the bone, to the liver. All those are places where breast cancer is spread to. That's a picture on the X-ray that shows you someone who had a tumor that spread to the lung. What you're looking at, this is the normal lung on this side, that's the shadow of the heart. And here you have fluid in the lung because the tumor is taken over, it's compressing the lung, and because nature doesn't like a vacuum, it fills it up with fluid. So you have fluid on your chest. It makes it very difficult to breathe. Well, Dr. Munro, if I get this thing, can I be cured? Well, that's a pretty difficult question to answer. The cure depends on a number of things. It depends on what stage of tumor you have. 80% of stage 1 breast cancer can be cured. 80%. You notice I'm not saying 100% of stage 1. Because even in what we call stage 1, some of those have already spread. They have what we call micro metastases. The higher your stages, the chance of cure diminishes. If you take a medication, 1/3 of them give you a complete response. 1/3 will have a partial response, and 1/3 will not respond at all. About 10% of the patients require radiation. Radiation is usually adjunctive to surgery and to the chemotherapy. Okay, so how can I stop myself from getting this thing? The truth of the matter is, you can to a certain extent, but then also there's some part of it that you have no control over. You have to be born into the right family. In other words, it's your genetics. Secondly, you got to live the right way in the right place. So there's an environmental impact on the genesis of breast cancer. I think some of you all know what chromosomes are. In biology, you have to learn that human beings have 46 chromosomes, X and Y. If you unravel it, that's DNA, a double helix, as we say in biology, that rolls into those chromosomes, and in that double helix, you have bases that tell you what the genes are. This is what I speak of when I talk about the incidence of breast cancer gene in this country. We call them BRCA, B-R-C, breast cancer gene. There are 2 of them, BRCA1 and BRCA2. And those genes really are to stop you from getting cancer. But when they mutate, when they become abnormal, when they misbehave, when they no longer carry out their function, and that is what puts the patient at risk. They are both dominant genes. So it means if you have them, you are going to get breast cancer. 100% of the time you're going to get breast cancer. If you were to do your BRCA study and you come back saying it's positive, then I can almost guarantee you, almost I say, because it still is the Almighty Father, you are going to get breast cancer. You have a 50% chance of getting endometrial cancer, and a 30% chance of getting ovarian cancer. So BRCA gene puts you at risk for at least 3 cancers. And of course, there are some other less common things that affect Jewish people more than black people. Leaf-forming, Peutz-Jeghers, ataxia telangiectasia, and then an enzymatic abnormality. But they all put you at risk, less so than BRCA. In the Bahamas, and this is a skewed thing, 20% of our women are positive for BRCA genes, 20% who have breast cancer. This picture really is just to tell you, or give you some idea of the complexity of how cell functions. It speaks to the reason why we have to do so many things. If you say you are treating breast cancer, there's no one thing that you can do to treat it. Because if you give one drug, and that drug functions in one pathway, your body has a way to bypass whatever that is. And the tumor cell is no different. So generally speaking, we use 2 or 3 different drugs in sequence to manage breast cancer. What about the environment? Well, in North America, there's something like 86 breast cancer per 100,000 in the population. In Australia, 71. In Europe, 67 per 100,000. So in those northern countries, and all of us try and be like the Americans. We try to be like the Brits. We try to be like the Australians. But watch the incidence of their breast cancer for whatever reason. Okay. If you come to the Caribbean, it's 33 per 100,000. So you can go live in China because you have 11 per 100,000. But then look to Africa, West Africa, where we all came from, or the majority of us, they have 19 per 100,000. So you know what that is speaking to? Our genes, our West African genes have been mixed with our white masters. Also, we are trying our best to turn our environment into the environment of our white masters. And therefore, our incidence of breast cancer is going from 19, it's nearly twice what it is from where we actually came from. So genes and environment both play a role in the incidence of your breast cancer. Again, in your environment, this is what we like to think of on a Sunday afternoon or Saturday. We're sitting down in our lazy boy. We got our remote, we got our beer, we got our cigarette, we got our pizza. We watching our TV. We're doing absolutely nothing at all. We're just sitting there. That is guaranteed to make you ill. That sort of behavior is a guarantee of illness. I know my wife is sitting there, but you know, it's always nice to go walking in the morning because you see some really beautiful young ladies. So all you all men in here, you need to exercise. You need to go out and exercise. Sweat. Drink water. You got to get your food right, your weight right. Stop smoking. Take your omega-3, vitamin, the cod liver oil, the vitamin C, your orange. Stop eating all those red meats. All that cold milk, hot dog, ice cream. You go to the vegetables and the fish. You need to go to this side. Vegetables, fish. Forget the red meat, the hot dogs, the ice cream, and so forth. You have to change your diet. In the Bahamas, again, just like that man sitting there, this is what we like, easy life. Calm lake, you got all those nice little donuts, nice background, everything. I like this picture. It's what I always say is, when we get married, everybody buys some really fancy china. Right? So you got all this fancy china in this closet, and when someone comes to eat, they want their plate full of food, so they can never see the beauty of your china. You should always serve them like this, right? This is beautiful. You can see the beauty of the china. The food is good, it's fish. You got a lot of red, you got a lot of yellow, you got a lot of green. They're grilled. They're not deep fried in fat. So you get advantage of the whole thing. You can see your china, you got good food there, you got proper food there. So make sure they see the beauty of your china when you invite them to dinner. They don't have to go with a belly full. It's the company that counts. Water. Very, very important. Majority of us in the tropical climate, we live in a water deficit. It puts all our body systems at risk. What am I going to do if you tell me I have breast cancer? Well, as I said, a lot of people say, well, I just need a good clean up. God is still in the miracle working business. Doctor, you don't know everything with cancer. That man down the road is dealing with Bush. So I'm going to check him out, right? What is it that you really should do? Accept the fact that you have breast cancer. Denial does not help. Get all the information about breast cancer that you can. The right source of information is the difference between success or failure in the treatment. How do you know if you have breast cancer? How do we make a diagnosis? Well, it's history, physical, and ancillary investigation. How long have you had the lump? Was it found by a screening test, a mammogram or ultrasound? What are your risk factors? Early menarche, late menopause, early onset of your period, or your periods don't end and then you're 55 or 60. What you do? Did you ever undergo an abortion? Did you breastfeed? Do you have a family history of breast cancer? Have you ever used hormone replacement therapy? All of these are important. Did you have another cancer, a lymphoma or something of that sort? And then the other symptoms in case the thing has spread. Both breasts needs to be examined.
Vincent, or pressure. You judge? It's judging.